I'd like to call the meeting of the Social Services Committee to order. It feels weird using this microphone, but we'll start with calling the roll.
Sure, Mr. Chairman. Fine.
Here.
Simpson and Joyce are excused. Cleary.
Here.
Epicoro.
Here.
Miller. Rosano.
Here.
Lockhart.
Here.
And Pearlie.
Here.
7 present, Mr. Chairman.
Thank you. First item of business is previous business, approving the previous meeting minutes. Do we have a motion? Motion, do we have a second? All in favor?
Aye.
Opposed? That's unanimous. Now on to the current business.
Item 2 is authorizing an agreement with the Legal Aid Society of Northeastern New York and United Tenants of Albany regarding the Eviction Prevention Intervention Collaborative. And this is your item.
Great. This is my, there's no one here. Okay. Great. I mean, this is the EPIC program. You may be familiar with it. A program that we last year now, at the end of 2022, we passed legislation to provide funding for a program to provide legal counsel for people facing eviction. It's a program that the city of Albany kicked in money towards too. And this will be a county-wide program, and we're calling this, this is kind of an EPIC Plus, we'll call it. It's both a combination of legal counsel for people facing eviction along with a rental arrears for people, to help people stay in their homes or behind on rent, which also helps the landlords, I want to add, who haven't received their rent. Any questions?
Please add me.
Okay, do we have a motion?
Motion.
Second?
Second.
All in favor?
Aye.
Opposed?
No.
2 noes.
Who were the noes?
Pearlie and Lockhart?
Okay, thank you.
Okay.
Was that 3-3?
No, there are only 2 Republicans.
4-2?
4-2. Or 5-2.
Oh, 4, okay. Sorry.
Okay, passes 5-2. I think that's the first item on the agenda, social services agenda, that's not been unanimous since I've been the chair. Because everything's been things that come from the committee. So it's a historic moment for this committee. Okay, so next item on the agenda.
Item 3 is authorizing agreements regarding the expanded in-home services for the elderly program. Commissioner McClave is here this evening.
I was going to say, where do you want me to? Good evening. We're requesting authorization to enter into contracts with 11 providers of home care services for the expanded in-home services delivery program. This is for folks who need home care services who are not eligible for home care under Medicaid. And it provides activities of daily living and support to people so that they can hopefully stay in their homes. And we've been contracting with any willing and able provider of home care services for this program.
Thank you. Are there any questions from the committee? Do we have a motion? Second? All in favor?
Aye.
Opposed? Pass unanimous.
Item 4 is authorizing an agreement regarding the Safe Harbor Initiative. Commissioner Manning is here this evening.
Good evening, Chair and committee members. So we actually have the Safe Harbor program. This is actually going to be an interdepartmental agreement with Albany County Crime Victims and Sexual Assault Center. They're going to be facilitating the program. They have a staff member that will conduct the assessments for the children and youth that are involved in sex trafficking. This is a $40,000 grant that we received from the Office of Children and Family Services.
Thank you, Commissioner. Do we have any questions? Ms. Lockhart?
Commissioner, this is a new program?
No, last month we accepted the Safe Harbor funding.
Right.
But the Safe Harbor program, we actually do an interdepartmental agreement with crime victims.
Oh, okay.
So it's basically we use a crime victim staff member to be the CSAC coordinator.
Okay. And you're talking about the 24-hour have a response?
Yes, crime victims, it's not our coordinator who responds to the hospital if there is an incident, but they use the whole pool of crime victim staff. So when somebody is brought to Albany Med after a violent act, they can actually be seen by a clinical social worker.
And most of those folks are volunteers with the program, right?
They are, but they're also staff members as well that work under Karen Ziegler.
Right, okay. All right, thank you. The Safe Harbor program, I'm sorry, Commissioner.
That's okay, you can keep that.
The Safe Harbor initiative, that's been around.
Yes.
How many people last year, or victims, I should say, have we?
I did get those numbers last time. Did you not receive them?
I didn't know.
Okay, I can
might have overlooked
read.
it, I don't know.
Okay, I can resend it. I don't have the numbers right off the top of my head, but after the last meeting, I did look up
Okay.
last year's and how many youth are currently being served, and then last year and the year before of how many youth have been served.
Okay, maybe I'll have to look back at my notes.
Okay,
I think you're right.
I think it was by that Thursday I got them to you.
I
Or
was wondering if the numbers were increasing, is what I was really.
they have been increasing steadily. I think it's the more education we get out there with law enforcement, EMS and other medical staff, that they're really identifying youth that are really at risk. And then there's also an assessment that is completed, especially when youth go AWOL from residential treatment facilities, that we conduct that when they return back to the residential program.
Thank you, Commissioner. Thank you, Mr. Chairman.
Ms. Rosano?
Hi.
Hi.
You mentioned specifically Albany Medical Center.
Mhm.
Is St. Peter's included in this program?
Um,
Do they have-
They've been working with Albany Med at this point in
Okay,
time,
so-
but that is something that we could explore down the road.
Thank you.
Are there any other questions? We have a motion to approve? Motion, second. All in favor?
Aye.
Opposed? Passed unanimous. Okay, next item on the agenda.
Item 5 is authorizing an agreement with Parsons Child and Family Center regarding the Participants Achieving Through Hard Work program.
Yes, thank you. This is our PATH program. Probation has been using this for over a year at this point in time. We had some STSJP money, that's supervision and treatment of juveniles. And so we actually had the opportunity to expand, so we have more slots for children that are involved in probation. They provide case management and a mentor that assists the youth for not further penetrating either the juvenile justice system or the family court system. The ultimate goal of this program is to keep youth safely in the community and not go into residential placement due to juvenile delinquent behaviors.
Thank you, Commissioner. Any questions? We have a motion? Motion. Second. All in favor?
Aye.
Opposed? Passed unanimous.
Thank you.
Thank you, Commissioner. Okay, next item on the agenda.
Item 6 is authorizing an agreement with CARES of New York regarding services for unsheltered persons. Christina Rust is here this evening.
Hello, everyone. My name is Christina Rust. I'm a policy analyst in the county executive's office. I haven't had the pleasure of meeting all of you yet, so for those who I have not met, hello, my name is Christina. So this is a request for a contract authorization between the county and CARES of New York for the Housing Resource Connection Program. And this program seeks to address the unsheltered homelessness, both in the city of Albany and the county as a whole. But it's going to have a particular focus on South Pearl Street, Lark Street, Henry Johnson Boulevard, and the Central Avenue corridor.
Great, thank you. Are there any questions from the committee? Mr. Burley?
Thank you, Mr. Chairman. Thank you, Christina. When you say focus, can you give us an idea of the breakdown of the, I guess, $300,000, 100% of which will be funded by county taxpayers? Breakdown financially of that $300,000, will all $300,000 be spent within the city of Albany in the places you listed? Or?
So that's a really great question. So how I understand the program is going to work is that when we contract with CARES of New York, they're going to be, part of that funding is going to be for hiring people to run this program through CARES. And they'll be going directly out on the street and trying to interact with these populations. So when it focuses on South Pearl Street, Lark Street, et cetera, they'll actually be going out onto those specific streets. So they'll be directly interacting mostly with people who are in that area, but the resources are not limited to people who are homeless in that area. So if there's, an unsheltered person who lives out in Colony and they took the bus somehow and they're in that area to receive those resources that they're offering, they will be able to access that.
Okay. I just know, anyone who visits, the old Northway Mall in Colony or Cross Gates in Gilderland knows that there are apparently homeless people, and that somehow they got there in those locations as well. So I would just urge that, the focus not be confined strictly to downtown Albany, but that it
Absolutely.
be expanded to cover other parts of the
Yeah.
county where apparently there's a need as well.
Ms. Rust, isn't the city of Albany providing matching funding as well?
They are,
for
they
this?
are. So that's why there is a focus, and that's why the actual employees of CARES will be specifically placed in these areas within the city of Albany. But again, if there are people from outside the city of Albany, like homeless people who are in that area of Colony, and they are able to somehow get to these areas, they will be met with the care and services.
Ms. Lockhart?
So there won't be any, the people I'm thinking of that are living in some tents in the village, they're not gonna go down to the city of Albany, they've just been all around the village. So nobody is gonna be reaching out to the other communities, they would actually have to say, oh, I need help, and go down to the city of Albany and find somebody on Lark Street versus somebody seeking them out.
Yeah, that's a great point. So again, from my understanding, this is both serving the city of Albany and the county of Albany, but it's going to be hyper-focused on the city of Albany. But I don't believe that it is exclusive to just the city of Albany. However, it's going to be a specific focus because there is matching funding from the city of Albany. But that would be a further discussion once the contract is authorized with social services.
Yeah, I'd like to add some of my thoughts. Because I remember, this was something we were at a a lot of us attended a press conference in this room last September to announce this program as well as a number of other mental health related programs. And I think we can all agree that there's a very large need for mental health issues throughout the county. And I think we should keep looking at how we can provide more resources to that countywide. But I want to add for this program, one, there's a high concentration of homeless people and people with facing mental health issues in downtown Albany, and I think we should look at it as a regional problem. A lot of these people, they come from places throughout the region, and I'll add, there's a lot of businesses downtown, and people from the region, from throughout the county, come to downtown Albany, and it impacts them. They're less likely to come down here when there's people out on the street, and the businesses down here, are less likely to be successful. We've been seeing a lot of them close, so I think it's something that really does impact the whole region, but I'll add, we should, Ms. Lockhart, keep pushing to get programs throughout the whole county, because there are a lot of mental health issues.
If I may, this program is for the entire county. What Christina was referring to is, and as the chairman is referring to, is that there is a high concentration in these areas, but that is not to mean this is a mobile service. They're going to go where the homelessness is seen and experienced. So those who are unhoused will be met where they are. So the only reason the proposal that it says that is just because there is a high concentration here. And it's hard to debate that, there isn't more homeless individuals in the city of Albany compared to Colony, but those in Colony will be met with services. This is a countywide initiative, to reiterate.
Thank you for clarifying that.
Just a
Yes, Ms. Lockhart.
comment, not criticism. I think the problem of the homeless, at least in like Colony in my community, it's not as visible as on the streets of Albany, okay?
Mhm.
Or in any city, probably. We tend to have people that are in the woods or in some of the abandoned motels. You just don't see them the same way that you might if you drive down Central Avenue through the city, and see people on the street sleeping or whatever.
Sure.
And that's a challenge, because you don't run into them until somehow the police need to be called for a problem. But they're there, believe me, they're there.
Yeah, and going off of that, it's not just on the street where they will be going. They go to shelters, hospitals, just anywhere that those who are experiencing homelessness are. So while there will be a reliance on a level of visibility, it is about working with community providers, churches even, where they're seeing it. So, but they will be mobile, they'll be moving around the community to connect individuals with the services that exist.
One suggestion I would have for this program is that we make sure that all local police departments who often come in contact with this population on the streets are well aware of the program so that they could reach out if they found somebody that was homeless and in need, besides interfaith. I mean, we have a lot of different things, but this looks like it's trying to be a particular type of program. And it's another tool for people to use to connect you to those homeless people.
Absolutely, and speaking to law enforcement, I mean, we do have a LEAD program as well, so it is about a umbrella of services, of mental health services, where we're trying to address mental health, homelessness, poverty, and the like.
Thank you, Jim.
Thank you. Are there any other questions? Motion. Do we have a second? All in favor? Opposed? Passed unanimous.
Thank you.
Thank you. Do we have a motion to adjourn? Second? All in favor? Opposed? Meeting is adjourned.